before treatment, the doctor should communicate thoroughly with the client to understand their treatment needs and target areas. Inform the client that all operators are professionally trained and that microneedle RF treatment is very safe. This helps relieve anxiety and prepares the client for the procedure. Prepare all necessary items: topical anesthetic cream, medical masks, tissues, facial cleanser, makeup remover, clean towels, antibiotic ointment, 75% medical alcohol, sterile gauze, and sterile saline. The doctor should patiently answer the client's questions and complete the microneedle RF pre-treatment consent form together. Select the appropriate cartridge according to the treatment area. 10 pins for hard-to-reach areas and linear stretch marks. 25 pins for the face. 64 pins for the body. Nano chip for infusion, lifting, and tightening. Cartridges are disposable. Rinse with saline before use, but do not submerge completely. Ensure the cartridge is dry before treatment to avoid damaging the machine. Cleanse the treatment area with a facial cleanser or makeup remover to remove impurities. Apply topical anesthetic cream and cover with plastic wrap for about 30 minutes. After anesthesia takes effect, clean the skin again. Take photos to document the skin condition before treatment for comparison. Set treatment parameters on the interface: RF energy, mode, pulse, depth, etc., according to the treatment chart. Treat the target area evenly, avoiding excessive overlap or missed spots. Apply a cooling medical mask for 15–30 minutes to reduce redness and heat. Apply a repair product, such as medical repair gel or growth factor gel 1 tum thick, to accelerate healing.